Hola a todos, bienvenidos al 31 Congreso Panamericano de Oftalmología. En este momento me encuentro muy bien acompañado del doctor Marcony Santhiago, nos acompaña desde Brasil. El doctor nos va a contar un poco más acerca de las ectasias corneales, del PTA, de la técnica SMILE, y más adelante vamos a hablar sobre la cirugía de femtosegundo. Entonces vamos con el doctor. Doctor, cuéntanos un poco más acerca de las técnicas de SMILE, del PTA, y un poco sobre las técnicas de la ectasia corneal, de las cuales diste tú una conferencia aquí en el Congreso.
Muchas gracias por la invitación. It's a great pleasure to be here. I will speak in English because it's a little bit easier for me, and I'm sure I'll get the message across a little bit better. So well, first we should talk about ectasia, which is a sight-threatening complication, a very important complication in patients submitted to LASIK. LASIK procedure is one of the most performed procedures around the world. So one of the most popular talks in all the meetings are the talks when we discuss the possible risk factors for ectasia. The session is always crowded, people really want to learn more and more about that. And we recently developed a concept called the percent tissue alter, which is what PTA stands for. So PTA, the percent tissue alter, is very important because as the postoperative corneal ectasia most likely represents a reduction in biomechanical integrity below the threshold required to maintain corneal shape and curvature. As corneal tensile strength is not uniform throughout the central cornea, with a progressive weakening in the posterior two-thirds, the relative extent of biomechanical alteration definitely plays a role in the postoperative weakening. Therefore, based on these corneal structural differences, it seems more reasonable that a ratio or a percentage would be more representative of the change that occurred after LASIK than specific cutoff values of residual stromal bed for everybody or corneal thickness, the same cutoff for everybody. So we therefore propose this metric, the percent tissue alter, which is for LASIK the combination of the flap thickness plus the ablation depth divided by central corneal thickness. And through the sequence of studies that we have done so far, right now we are going to the 8th study specifically about PTA, we have shown that PTA is the most robust variable to identify the patients that are at higher risk for ectasia in eyes that present normal topography. So PTA is better than residual stromal bed, cutoff values of residual stromal bed, cutoff values of corneal thickness. All the variables that we know from the past are also very important, but PTA we have shown through the combination of our publications that PTA presents a higher correlation between this risk factor and ectasia. So we show that patients that present a PTA higher than 40% presents a chance that are 200 times higher to develop ectasia than patients that present a PTA below 40%. So this is a very important finding. We also show through the analysis of all these studies that there remains a correlation in patients with abnormal topography too. But PTA is stronger in eyes that present normal placido disc-based topography. But you also asked me about this new technology called SMILE, small incision lenticule extraction. It's a very important new promising technology. I think it will gain room with time. We are still trying to understand better how the patient would heal after that. We need the fast wound healing after SMILE and more predictive results. But I'm sure it's going to be a great technique because you spare the deep cornea. The anterior cornea, you only do the surgery in the posterior cornea, and then having the anterior cornea intact, theoretically, the change in biomechanics are less. So I think SMILE is a very promising technique. I'm still working with LASIK with femtosecond. So I think today femtosecond LASIK is very, very predictable technique. So it's my option now. My patients are really, really happy. I do PRK a lot, but with femtosecond LASIK, right now I'm not thinking about changing to SMILE, but it's definitely a very promising technology. We had a chance to see here during some of the sessions that I was involved. Very good talks about SMILE. I'm also the associate editor of Journal of Refractive Surgery, and we receive papers about SMILE every month, very good papers. So we are learning, we are evolving, working together all the world, we are evolving in this technique, but I'm sure it's very promising. And you also asked me about femtocataract, right? You know, before I specifically talk about femtocataract surgery, I would talk about femtosecond in general. That was a great thing for us that are in the cataract and refractive surgery field. Because with femtosecond laser, we have more predictable surgeries in LASIK, we have more predictable surgeries with intracorneal rings, we have more predictable corneal transplants, and a more predictable wound healing after all these procedures. So when we talk about femtosecond in cataracts, it's the same path. It's the same results. We have a more predictable surgery. That's the point. You know, a lot of people ask, well, if you are already a very good phaco surgeon, why should you go from phaco to femtocataract surgery? Because you are going to eliminate all the variables that we would have. Even a very experienced surgeon could still have some situations where he could think, well, should I do this or that? With femtosecond, you reduce that variables. You know, there will be more surgeries that are just the same with femtosecond. And when we talk about more challenging situations, for example, Marfan's case, so it's better to have a technique that decreases the chance of any complication. So it's a very promising technique. I'm a huge fan of femtocataract surgery. I think I answered all your questions. Did I?
All my questions were answered. Doctor Marcony, muchas gracias por estar aquí con nosotros y felicitaciones por su participación aquí en el Congreso, en especial por esas charlas que tuvieron lugar el miércoles sobre estas técnicas que están dando mucho que hablar ahorita en el campo de la oftalmología.
Muchas gracias por la invitación nuevamente. Bye bye. Bye bye para todos.